Hi, everybody. I think people are just joining gradually, so you're all very welcome. We'll wait a couple of minutes and then we'll do a proper welcome. So yeah, we'll start in a minute or two. But thanks everyone for coming. Hi everyone, thanks for coming. I think there's still a few people trickling in, but I think most of us are here, which is fantastic. There's loads of people come to this exciting webinar from the Tackling Loneliness Hub. So thank you all for coming. It's brilliant to see you all here. I'm Harry Hobson. I'm one of the directors at Neighbourly Lab, and also there's Abba on the call, the community manager for the Tackling Loneliness Hub. And also Sarita, who works on the Tackling Loneliness Hub as well. Thank you all for your support and your membership and being part of the Tackling Loneliness Hub. It's a wonderful thing. Neighbourly Lab have the privilege of running it for DCMS alongside our partners, Sheffield Hallam University. So yeah, let's get into this. It's brilliant. We're going to be talking about well-being measures and WELLBYs, which is one of the most kind of in-demand topics, I think, on the Hub to cover, because it's just kind of so topical, such an important and exciting way to be able to measure the efficacy and the impact of the kind of interventions that we do or that we experience to do with tackling loneliness. So it's brilliant. Thank you for coming. I'll introduce our two speakers in a minute. Just very quick, two bits of housekeeping before I do that. First of all, this has been recorded, this meeting, just so you know, and the recording will be available on the Hub later or tomorrow, so you can watch it back or post it to your friends or whatever. And then secondly, needless to say, it's an interactive session. We'd love your questions, of course. That's what we're here to hear and to answer. So you can put questions in. There's a Q&A button. Can everyone see a Q&A button at the bottom of their screen? I think you can, hopefully. So that's where you put your questions, and Abba and I will spot them and we'll ask them on your behalf. All the speakers will spot them. And also you can chat or introduce yourself in the chat function as well if you'd like to. So yeah, go ahead and do that. So yeah, let's get going. I'm going to very quickly just say something about both speakers, and then I'm going to hand over to you, Chris, to go first, and you're going to share some slides. So the running order will be me introducing everyone for a minute, then Chris is going to present for 10-15 minutes, and we'll have a few questions after that. Then John's going to present for 10-15 minutes, so we'll have more questions after that, and then we'll wrap it up and we'll finish before the hour, give you time for a stretch your legs or get a sandwich or whatever. So yeah, we've got our two speakers is John Franklin, who's the chief economist from Pro Bono Economics, which is a wonderful organization that we at Neighbourly Lab have worked with for many years, and certainly kind of the most kind of respected organization, I think, that kind of works in the social sector for kind of economic analysis and helping to measure impact. So we're delighted to have you, John. Thank you so much. And also Chris Krekel from LSE. And Chris, you also hold a position at Oxford University, I think, as well, don't you? Maybe, is that right, isn't it? So maybe as you start your slides, just remind us of the teams you're in at LSE and Oxford. But it's incredible to have you here as well. And I know you two have worked together on lots of things which you'll talk about. So okay, let me hand over to you, Chris, if you'd like to go ahead and share your screen.
Yeah, thank you so much for the
introduce yourself.
Thank you so much for the introduction, also the kind invitation. It's really a pleasure to be here and to be able to speak to you. So my name is Christian Krekel. I am, as you said, an assistant professor in behavioral science at the London School of Economics. I work in the Department of Psychological and Behavioral Science, but I'm also associated with the Center for Economic Performance and the Community Wellbeing program there, as well as with the Wellbeing Research Center at the University of Oxford. And so within the next 10, 15 minutes, I'm trying to set the scene, in terms of what is well-being, and of course, what is the WELLBY, how do we define it, how do we measure it, and what is sort of like the initial monetary value. And then I'm handing over to John, who is sort of like giving interesting case studies and sort of trying to apply that. So yeah, to start off with, I think I start with a definition of what we mean by well-being in the first place, because well-being is, of course, the underlying concept of the WELLBY. So well-being is defined, and I'm going back here to a definition by Ed Diener, who is sort of like the founder of positive psychology. Well-being is defined as subjective well-being, in short, well-being or happiness as a person's affective and cognitive evaluations with his or her life. So when we talk about well-being, we actually mean subjective well-being, but we often say well-being or happiness in short. And basically, there's two different components. It's affective and cognitive evaluations. To make this even a bit clearer, I would say, and amend this definition slightly and say that subjective well-being sort of consists of affective experiences and cognitive evaluations. So these two dimensions, so experiences and evaluations. And affective experiences is essentially the presence of positive affect and the absence of negative affect in a given period of time, or net affect, essentially how a person feels on average in a given period of time. This could be, for example, how happy you are right now, or have been in the last hours, how much purpose you feel right now, whether you have been anxious today or worried, your sort of like elation in the moment, your happiness in the moment. That's sort of like affective experiences, really in the moment how you're feeling right now. The second dimension is cognitive evaluations, and that is sort of like asking you to sort of step back and evaluate your life cognitively relative to some sort of ideal life you have in mind. So essentially, well-being here, according to this definition, is the evaluation in a given period of time, and often we look at a year, for example, of how a person, thinks how satisfied they are. Examples here are, how satisfied you are with your life overall, how satisfied you might be with your job, how satisfied you are with your family life, government satisfaction, even sort of like a sense of purpose in life, right? It's sort of like a cognitive evaluation. So it's sort of like different from an affective experience. It asks you to sort of like step back, think about your life as a whole or certain domains of your life, and then sort of like come to some cognitive evaluation. In policymaking, in the UK and elsewhere, we are particularly looking at cognitive evaluations. And I'll tell you in a second why this is the case, mostly for practical reasons, but we're looking particularly at cognitive evaluations, and we're looking particularly at somebody's life satisfaction. Because we argue that life satisfaction is sort of like an overall measure of, well-being of people's lives, right? Some sort of like overall utility measure. And life satisfaction is measured very, very simply. Usually the standard measure we're having in the UK by the Office for National Statistics, but also in many other surveys, is simply a Likert scale question that goes from 0 to 10, and that sort of asks you, how satisfied are you with your life, all things considered, or slight variations of this question. And 0 on the scale means you're completely dissatisfied, and 10 means you are completely satisfied. So it's a very simple question, very cheap and easy to collect data on. It's integrated in many surveys, and we know a lot about it already. Now, in policymaking, so in the UK, but also elsewhere in the world, we are looking particularly, when we talk about well-being, as I said, at cognitive evaluations as opposed to affective experiences, and in particular at the cognitive evaluation of life satisfaction. And why is this the case? There are various reasons why we're looking at that particular measure specifically. For one, it can be seen as democratic, right? We ask people to be the judges of their own lives, right? I mean, we're not inferring this from their behavior or asking other people. One can also interpret life satisfaction in a way as the vote of somebody on his or her life, right? And there's one person, one vote, so it applies to this principle. We don't have to make assumptions, which we would have to make in terms of when we would be using affective experiences. We would have to aggregate this over certain time periods. With life satisfaction, we usually have a time period of 1 year, simply by the convention that we ask many surveys in a sort of like on an annual basis, right? But we make sort of less assumptions on aggregation. If we look at life satisfaction, sort of like the correlates of life satisfaction, particularly objective outcomes or revealed behavior, we find that life satisfaction correlates very well with objective things that are good in life, right? I mean, if we look at people who live longer, they're usually more satisfied with their lives. If we're looking at people who are for example, at the lower end of life satisfaction in the so-called misery range between 0 and 4 on the 0 to 10 scale, we find these people are in all sorts of like objective misery, like unemployment, loneliness, poor mental health, social isolation, and so on and so forth. So it does actually correlate quite well with sort of objective outcomes. And it also predicts individual behavior. So people who are more satisfied with their lives, I mean, they're more likely to vote for the incumbent government. They're more likely to take care of themselves in various ways by not engaging in risky health behaviors. They're more likely to sort of like, sort of like stick in their current situation as opposed to sort of like changing this. So, for example, we have found that people are less satisfied with their job as a particular domain satisfaction. They're more likely to change their job. Same for relationship satisfaction, housing satisfaction, and so on and so forth. And finally, as a behavioral scientist, what I like about life satisfaction is that it also captures I would say uniquely captures certain behavioral scientific phenomena. For example, that we are getting used to changing life circumstances, and we can actually track this quite nicely in life satisfaction data. Or that we make anticipation errors, right? That we do not really sort of like predict what makes us happy. Or that we are, engaging in relative comparisons with other people, aka jealousy, right? I mean, that we sort of like a social beings that engage in all sorts of relative comparisons, and that it matters where we're relatively standing relative to others. At the same time, where there might be spillovers. And of course, for policymaking, also things like being treated fairly and with dignity. So aspects of procedural utility are, in my opinion, uniquely captured by life satisfaction data, and they wouldn't be captured by for example, traditional indicators like income, right? I mean, so life satisfaction well-being data is particularly good here. And for life satisfaction specifically, as I said, it's a one item Likert scale, right? It's cheap and easy to collect. It's very easy to interpret and also straightforward to analyze empirically. And of course, since the advent of positive psychology, we now have a huge evidence base on actually what matters to people's lives and what does not, both in the UK and also internationally. And importantly, the Green Book, which is sort of the Treasury's official guideline for policy analysis, so policy appraisal specifically, also permits to use well-being data now for policy appraisal, for example, as a measure of benefit and cost-benefit or cost-effectiveness analysis. And the measure they're using is based on life satisfaction, right? And these are actual decision-making tools which can be used to ask for money at the Treasury and to sort of like show that particular interventions are worth the money. And again, so the Green Book and its supplementary guidance on well-being has a particular focus on life satisfaction. In terms of what matters for life satisfaction, I usually show my students here this nice pie chart, which is taken from, I think, the Understanding Society dataset in the UK. And the different shares in the pie chart is the share of the variation in life satisfaction that is explained by the respective factor. And specifically when it comes to loneliness, which is related to low mental health and also, social relationships, we can see that mental health explains around 47% of the variation in life satisfaction, of the explicable variation in life satisfaction. So mental health has a huge load on people's life satisfaction. Life satisfaction is not the same as mental health, but of course mental health is the strongest predictor of life satisfaction, much more so than physical health, which explains less than half of it. And also being partnered as sort of like a proxy for having good social relationships explains around 16% of the overall explainable variation of life satisfaction. So taken together, we have 63% of elements that are sort of clearly related to loneliness that explain, around 63% of the variation in life satisfaction. So loneliness would be very nicely be picked up in life satisfaction data. Now, before handing over to John or being open for a couple of questions, I just want to introduce the WELLBY, because the WELLBY, as you might have guessed, is also built on life satisfaction data. The WELLBY, and it stands really for Wellbeing Year. It's a measure of well-being benefit that can be used in cost-benefit and cost-effectiveness analysis as per Green Book guidance. It's defined as 1 point of life satisfaction measured on a 0 to 10 Likert scale for one individual for 1 year. So, for example, it is the change from 5 to 6, or from 3 to 4, or from 8 to 9, or from 2 to 3. This is one WELLBY, right? And the value that the Green Book puts onto one WELLBY is £13,000 in 2019 prices, and if you inflation adjust this into 2023 prices, you get to 15,528 pounds. So this is how the Green Book values one jump from, say, 5 to 6, so one WELLBY, or from 7 to 8, or from 9 to 10, right? So that's around 15,528 pounds in today's prices. So the good thing about the WELLBY and why it's sort of like become popular and sort of widely spread and used is that you do not need any complicated formula to, translate well-being changes into monetary terms in, say, your cost-benefit analysis to contrast them with costs. So say, for example, you have some intervention X, right, that reduces loneliness, and you can measure the effect of your intervention X that reduces loneliness on life satisfaction. And if we assume that the effect is simply 0.15 points on a 0 to 10 scale for one individual for 1 year, the only thing you need to do to sort of like monetize this for example, your cost-benefit analysis is to take the 0.15 points and multiply it with a monetary value of the WELLBY. And so in this case here, your intervention X to reduce loneliness would be worth for one individual for 1 year about £2,000, £1,950. So that's sort of like really the appeal about the WELLBY, that it's actually quite easy to use, and you do not need any sort of like complicated formulas or anything really to sort of like make a case for the well-being impacts of your intervention in monetary terms. And that's the part of my super quick introduction. I'm happy to answer any questions you might have.
Brilliant. Thank you so much, Chris. That's fantastic. Can I ask a couple of questions on behalf of people who might be kind of new into this? Well, I think 2 questions. First of all, in terms of this 0 to 10 scale, you mentioned, you kind of sometimes think of the first 4 deciles as like a misery zone or whatever. Is there a sense of adequacy? Is there a feeling that, like, that a certain number is good enough? Or is there a sort of inflection point somewhere in the scale where there's a point of adequacy or good enough? That's my first question. My second question is a sudden, that figure of £13,000 sort of popped out suddenly. I mean, kind of how do you get to that figure? What's the rationale for why that's the right figure for 1 point?
Yeah.
And then,
excellent question. Yeah. Excellent question. Thank you so much.
That's
so
okay.
There's no sort of like saturation point per se. But we know, for example, from sort of like simply correlations and empirical evidence at 0 to 4 is sort of like where there's sort of like, heightened misery. There's also like work ongoing in terms of, is there any point on the scale that clearly corresponds to sort of like being indifferent between life and death, right? And people have been trying to estimate, okay, is there a value that is higher than 0? Where people are actually indifferent between life and death. So are there sort of like states on life satisfaction scale which, people are rather want to be dead than living these kind of like lives? And so currently, I think the Green Book says that, the current value is 1, and that value comes from correlating the sort of like number of people who are rating to be at 1 on a 0 to 10 scale with the number of suicides in the UK. And I think that's sort of like where it comes from. But there are other attempts where people simply ask people, okay, which is the point at which you would be indifferent between life and death? I think there people have been saying 2, but you can see that's kind of like tricky because it's like a very difficult thing to answer cognitively.
But what about higher up the scale, at the top end of it? Is there a point like at 7 or 8 or something where you might say that people have enough capacity to flourish or enough agency
definitely
to live kind of life they want or something?
The mean is about 7 to 7.5, and that's usually yeah, I mean, that's sort of like where I would say,
That's useful, but that's
or
the
8, where
meaningful.
people have enough. There are also, of course, people on 10, right? And the scale is bounded, right? I mean, you can't go higher than 10. And that's also okay, I think, from a theoretical perspective, because, simply our, life is bounded, right? I mean,
Mm.
there's just so much happiness you can even physically, in terms of dopamine, right? Serotonin experience in terms of your perceptual apparatus that you have as a human. That's sort of like, this is sort of like bound.
Mm.
In terms of
Yeah.
your second question and the sort of where does this monetary value come from? So there's two ways to go about it. I mean, we have a book in which we looked at it. We looked at the quality, and the quality is, a measure that is standard being used in the UK, and that's defined as 1 year in perfect mental and physical health. People in understanding society who are, rating themselves to be in excellent health, which should correspond to one quality, they are usually 8 on the scale, a 0 to 10 scale. And what we then did is we took the monetary value of the quality, and we basically divided it with the 70,000 in 2019 prices, according to the Department for Transport, and we divided it by 8 minus 1, and 1 is the point in which people are indifferent between life and death. That is then 70,000 divided by 7 gives you 10,000. And then there's also work being done by Symmetrica Jacobs, and they've been looking at, I think they sort of like choice experiments, and hence derived an income coefficient. That gets quite complicated now.
Yeah.
Income coefficient based on choice experiments. They came up with a higher value of 16,000, and the midpoint is 13,000.
Okay.
Hence, the midpoint is the
Good.
recommended value, and for sensitivity analysis, people have been using also 10,000 and 16,000 as some sort of like to see whether this makes any difference to your cost-benefit analysis.
Okay, thank you. Okay, thanks, Chris, for answering those questions. There are a few more questions in the chat. I think, Ingrid, your question sort of relates to what we were asking about on the scale. Ingrid asks, isn't a drawback of well-being that it values a move up the scale from 7 to 8 the same as a move from, say, 4 to 5?
Yeah, I mean, that's of course something to be debated, right? One can argue
Yeah,
that, we should value sort of like changes at the lower scale more so than at the higher scale. My
yeah.
understanding from the sort of like political economy context of this is that it actually gets quite complicated to actually do that, and hence I think it's politically probably easier to sort of come up with one value for everybody, because also we mostly count people like equal in cost-benefit analysis, so kind of utilitarian. And then maybe then if one really wants to derive weights, use these weights sort of like ex post and apply them to like different types of people.
Okay,
I think there's also a sort of practical point to add to that, in that, well, 2 practical points. One is that getting the strategy right for your policy or your intervention from the beginning matters. So you can't just crunch the numbers on the Wellbys and hope you're landing in the right place. You've got to think about who you're targeting from the beginning. But using well-being as a way of understanding that and understanding who you're supporting by understanding what are their starting levels of life satisfaction is a great way of picking out where they are in that distribution. So getting that sort of strategy right from the starting place of who you're targeting matters. But the second practical point is, in practice, it's a lot easier to move somebody from a 3 to a 4 or a 4 to a 5 than it is to get somebody from an 8 to a 9. Like, in practical purposes, based on the interventions we see, it's a lot easier to move people up from those lower levels, which is kind of what you'd expect. It kind of gets tougher to give people even more happiness once they're right at the top levels. So practically speaking, the kinds of interventions that are going to make the biggest difference using a Wellbeing approach will be those that are targeted at people at the lower ends of the spectrum. So yeah, there's a couple of practical reasons that mean that, although theoretically I agree with what Ingrid's saying in terms of that weighting, it's easier to have just a simple, straightforward approach to it, and in practice it tends to favor interventions focusing at those people at the lower end of the distribution anyway.
Okay, that's really helpful. Okay, brilliant. Thank you. There are some excellent questions appearing in the chat, but I'm going to save them for after you've spoken, John. But Chris, maybe while John's talking, just take a look at the Q&A.
Yeah, I'll try to answer some if I can. Okay. Thank you.
But yeah, and because especially those questions start to be about how we actually use them in local government in a day-to-day way, and also could kind of questions about, the kind of risks of asking these kind of questions to people who might be suffering, especially, for example, young people suffering mental health issues already. So those are some of the questions which we'll come back to in 10 minutes time. But John, let me hand over to you, if I may. And I know you're going to share your screen and share some slides and build on what Chris has introduced. So thank you.
Brilliant. Thank you very much. And thank you for inviting me along. Just give me one moment to share those slides. Hopefully they will pop up for everyone. There we go.
Yeah, perfect.
So it's actually really helpful to follow Chris, because I'm trying to go from the sort of the outline that Chris has given at a high level of what well-being is about, what it's trying to measure, and how we go about doing that, into some practical advice of, if you wanted to use this for your organization, what would that mean? And I'll try and make it as kind of simple and straightforward as possible, but obviously that represents the very tip of this much larger iceberg of research and evidence that sits underneath it that Chris has sort of touched on, which fundamentally we think helps give well-being and the Wellby approach a real kind of theoretical and weighty grounding, and then the practical steps of how you use it on top are all built on top of those foundations. So Pro Bono Economics, we're a charity, and we've sort of bought into well-being at a level where we've wrapped our entire sort of strategy and mission around it. So we exist to use data evidence, the skills of economists, to support organizations tackling the causes and consequences of low well-being. So we're kind of really focused on that bottom end of the distribution, those people that have got the lowest quality of life, that are struggling the most. How can we tackle the causes and consequences of that? And we do this in a couple of ways. One is working one-to-one with individual charities and funders to help them measure impact of complex social interventions, like those that you guys might be running in terms of tackling loneliness. And then we also do it from a more top-down policy perspective. And we think loneliness kind of well-being has lots of value to bring at both of those levels, in terms of thinking about both bigger policy changes, but also the way that we can evaluate individual interventions. I'm going to focus more on the sort of evaluation side. So if you wanted to evaluate a particular intervention or a program that you're running to tackle loneliness, what does that look like in practice if you want to take a Wellby approach? And the starting place, whenever we talk about this, is to flag, look, there are lots of different approaches to evaluation. I'm going to be talking more about the kind of quantitative end, so using that Wellby approach in a very quantitative way, putting numbers around it, and looking at the economic or social value of that. That's partly because that's what we specialize in, but it's also the bit that most charities tend to find more difficult, and more complex and harder to access. So I'm going to be talking more around this, but I don't want that to be taken away as that's in some way more important or the right way of evaluating things. Qualitative evidence, case studies are just as, if not far more important than doing the quantitative work. The reason we do the quantitative stuff is, as I said, it's something that a lot of organizations struggle with, and it can be helpful with particular types of stakeholders. So depending on which bit of government you're dealing with, it can be useful in terms of influencing government departments, local authorities, and it can be useful with stakeholders, particularly if you've got kind of corporate funders or anything like that. Often having that kind of picture of the broader social and economic impact that stems out from the work you're doing can be a helpful communication device. And to be blunt, like the main reason most organizations approach us around this is because they want it to help them raise money, and we've got lots of case studies where that has helped them to access new funders, and allow them to deliver more of what they do. But always like to emphasize this up front. I'm going to do lots of talking about quantitative evidence, but that's not the only or the right way of doing it. It's important to have that balance between the different types and different approaches, and you could cut it in lots of different ways, well beyond what I've got on this current slide. So why do we like well-being as a way of measuring impact in the social sector? I mean, this stems right back to, I've been working with PB now since 2015, 2016. And I've worked with literally hundreds of charities and social sector organizations over that time, and applied a range of different techniques to valuing and understanding their impact. And it's fair to say that using more, I guess, traditional economic approaches to evaluation always left me a little bit unsatisfied. And well-being as an approach feels like it's offering a massive opportunity to the sector to understand its impact and value it in quite a different way. And there's a number of reasons for that, some of which are very general and some of which are specific also when we think about loneliness and organizations trying to tackle loneliness. So as Chris highlighted, look, it's pretty simple and pragmatic. We're not talking about 40 item scales which need to be administered by a psychologist. These are straightforward questions that can be incorporated into standard surveys that lots and lots of social sector organizations will run. More importantly, it's sort of focused on what social sector organizations, charities really care about. because it's focused on the quality of life of the people that you're supporting. It's not about, well, do you end up saving the NHS money in a couple of years' time, or are you adding to GDP, which might be a nice byproduct of what lots of you guys are doing, but it's not really fundamentally what you guys tend to care about. It's about the quality of life of the beneficiaries that you're supporting and trying to improve that and help people to improve that for themselves. So it feels like it's far more focused on what charities really care about. And then more pragmatically, you can get quite a decent standard of evaluation, so a quality of evaluation from it. And there's a number of reasons for this. Partly it's about that Treasury endorsement and that Treasury valuation approach that Chris mentioned earlier on around the Green Book guidance, but also because these standardized measures of well-being have been rolled out in lots and lots of surveys, it's relatively easy to come up with some kind of comparison group to understand, well, how have the well-being of the people you support done over time compared to a group of similar people that haven't received your support. And having that comparison group can really increase the quality and the robustness and the strength of the conclusions you can draw about the impact of your organization. And to put it really, really bluntly, because often charities come along because they want a big number from us, which helps sell what they do. Actually, you can get some quite decent sized pounds and pence numbers using a well-being approach. So, that's not what it's really about, but that does help. So it's worth flagging that actually that kind of valuation that Treasury have put on well-being improvement is a pretty fair and decent sized valuation. There's lots of arguments that it could and should be higher, but actually as a practical tool for kind of putting a size, a number, of value on the impact that social sector organizations have, it works pretty well. In terms of loneliness specifically, there are a couple of challenges that kind of came to mind in terms of thinking about why a well-being approach or a well-being approach could be helpful. There's an ongoing debate, as I'm sure you guys will all be very well aware of, around what's the right way of measuring loneliness, and in particular, how sensitive some of those measures of loneliness and social isolation are to the kind of interventions that might be put in place. Does that sense of loneliness tend to change very rapidly? Does it respond to the kinds of things that we would expect it to? And using a well-being approach helps you get around that a little bit, and it's another way of asking about it. It's another way of understanding the quality of life without having to specifically get into that issue and the sensitivities that come around it. So that may be an advantage. It may not be. That's kind of up for debate. But I think the other real reason that we quite like it for loneliness organizations is that lots of social sector organizations, in the work they do, they will help to address and tackle loneliness, but it's not always like the core focus. Not necessarily we are running a loneliness program. Actually, they might be running a program which is about, I don't know, getting people into arts and crafts and activities. And that has a whole host of benefits, which we would argue are kind of captured by that umbrella measure of well-being or quality of life. But some of that will be down to addressing loneliness and giving people social connections. Some of it might be about confidence and building new skills. Some of it could be, I don't know, physical activity or something else that gets them involved in it. There's lots of different routes that a particular intervention could be having to improve the quality of life that aren't just about loneliness. So well-being kind of works as a much better umbrella measure if your intervention isn't solely focused on loneliness, if that's one part of what you deliver through a program, through an intervention that you run. So those are the kind of reasons that we found it really useful as a tool in the work that we do in evaluating charities and social sector organizations. But if you want to take that forward, if you want to do it, what sort of data do you need to capture? Well, at the simplest level, if you really, really boiled it down to the bare minimum, if you were able to add in the life satisfaction question that Chris talked about earlier on, so overall, how satisfied are you with your life nowadays, measured on that scale of 0 to 10, at the start of the intervention, so you get some sort of baseline, and that may not be on very first contact, but somewhere near that that early contact that you have with the person you're working with, and then a second measure at a later date, then you're in a pretty strong place to start understanding, well, what potential impact are we having on well-being? Now, that follow-up at a later date, it will depend on the nature of a program. You can have some programs that are very fixed length, so it makes sense to do it baseline end of the program. You can have some which are open-ended, in which case you might want to pick, okay, we're going to follow up 3 or 6 months after the baseline. But if you can start to build that in, then immediately you're getting some really valuable data. First of all, at the baseline, who are the people we're supporting? Where do they sit on that kind of big national distribution of well-being? What's their quality of life look like compared to other people? And then the follow-up, the next measure that you get helps you understand that change over time. And that's kind of at the core of that WELLBY idea that Chris talked about earlier on. Now, there are a couple of complications to add into this. First one is most of the data that we might use to sort of benchmark and compare against using the well-being is gathered at 12-month intervals. And the whole concept of a WELLBY is based on improvements of well-being that last for at least a year. So it is helpful if on top of the baseline and end of program or 3 or 6 month follow-up, you can gather some slightly more longer term data. So maybe a 12-month follow-up, but could be anywhere between 8 and 14 months. Realistically, we could probably make that work, but slightly longer term follow-up. And I'll talk a bit more later and give you a kind of very practical example of how and why that makes a difference, but that can really influence the strength of the conclusions you can make. So if you can build in that sort of follow-up data, that can be really helpful. I think the second thing is getting a bit more data at baseline level. Sorry, my cat has just come in and decided to nibble me, which is helpful. So
is that
if we want to make that,
is that contributing or detracting from your well-being?
Very much detracting right now. I would say on average, my cat detracts from my well-being. But hey, that's my problem. I'll deal with that. So the other thing is that in terms of, it's not necessarily quite as simple as just gathering that life satisfaction measure. And there's two things here. First of all, look, life satisfaction is one component of overall well-being. It's a component that gets a lot of attention. It's the component that's built into the Green Book guidance. But actually, if you want a more complete picture of somebody's quality of life, you might want to consider other more complex measures of well-being. So there's the ONS4, which adds in 3 other measures that capture different dimensions of well-being. Or there are sophisticated measures like the Warwick Edinburgh Mental Wellbeing Scale, which captures mental well-being and captures a number of different dimensions. So if you wanted a really complete picture of well-being, we're probably oversimplifying things a little bit by boiling it down to the life satisfaction question, but that can be a useful place to start. The second bit is that if you want to get that slightly higher quality evaluation, where we've got the comparison group, it can be useful to have a little bit of additional information on top of just life satisfaction. So it's useful to capture some information on some of those other factors that Chris mentioned earlier on that can influence levels of well-being. And that just means we can get a much tighter match in terms of finding similar people from some of those national survey data sets that we can use to the ones that you're working with, and make sure that we're linking that a little bit more closely. So that will give you a slightly higher quality evaluation again. So the kinds of things that we want to capture are physical health, mental health, loneliness, employment status, income. Those don't need a massively long list. You could probably shorten it down to a list of fewer than 10 questions, but there are some questions there that are useful and can help strengthen the evidence as well. The final really practical thing to kind of flag around gathering life satisfaction, I think this was touched on in some of the questions as well, was around you need someone who's prepared to ask these questions. So it's really important to get that buy-in of staff, because you can have a perfect theoretical framework for evaluating any intervention, any impact, whether you're using well-being or not. But actually, if your staff or volunteers, whoever it is that's going to be asking that question, feel uncomfortable about it, then you're not likely to get any decent quality data. So going on that journey with your members of staff to help them buy into this as an approach can be really, really important. And there's a few things that have come up from the experience we've had around this that can help with that. I think, first of all, there's sort of framing it with the staff members, in that the experience we've had with lots and lots of other organizations, so organizations that have implemented this in domestic violence refuges, in homelessness centers, so working with really vulnerable, sensitive people with mental health difficulties, is that the fear of introducing this sort of question is often far, far worse than the applied experience. So kind of framing it that, look, you need to once we get started, it will likely feel a lot easier than it does right now. That's an important part of it. Also, these are questions that have been rolled out in lots and lots of circumstances, as I just mentioned, and it can be done successful. So this is not something that will be unique to your organization. It is something that has been done in lots and lots of sensitive, difficult situations, and you can find ways of doing it. And there will be organizations out there that you can learn from who have tried to implement it in similar sensitive situations. But the main thing in terms of managing some of the concerns that often staff members and volunteers will have about using these kinds of questions is, what do I do if it prompts some kind of adverse reaction? So in the vast majority of circumstances, will not have any problem whatsoever. In fact, the feedback from people that get asked these questions is they actually quite like it, because it's inviting them to talk about their overall quality of life and the experience they're having, rather than just focusing on all their problems. And so it generally gets a very positive reaction. But understandably, if you're a member of staff who's going to have to ask this question, you're going to be worrying about that worst case scenario. What's the worst case scenario that could happen? What sort of adverse consequences could I get? So coming up with a clear plan of attack for within your organization, how you would deal with that situation is really, really important. So, and that will vary based on context, based on the organization. But is it that you will stay on that call, or you will stay with that person for as long as it takes for them to calm down? Is it that you refer them on to other organizations who can give them more immediate or crisis support so that they can get the support they need? Is it that you escalate it up to clinical supervision? Whatever it might be that makes sense for your organization, think that through in advance, so that if in the very, very, very unlikely situation that that happens, your staff member knows what to do. They've got a plan of attack, and that tends to be the most important thing that we've seen in terms of helping to manage down that concern, that uncertainty that members of staff and volunteers can have about using these kinds of questions. But I just, re-emphasize, in vast majority of circumstances, it's not a problem. In fact, people like being asked about their life satisfaction and their quality of life. So that's the data. On one level, very, very simple, but there are a few more complexities that were sort of built into it there as well. What could this look like in practice? Right. So I have used an example here that isn't yet published, so I can't say who it is yet, but it's a horticultural therapy organization. So essentially they use gardening activities as a way of engaging people, and that has direct benefits in terms of well-being. It's potentially physical activity, it's potentially tackling loneliness. So that's another reason why I've used it here, is it's a good example of the kinds of interventions that loneliness is not necessarily the core purpose, but it's one of the ways that they support people. It gets people out in the outdoors, in the green area, which has been linked to improving well-being. But from their perspective, all of this is primarily just a hook to establish a bit of a trusted relationship with the horticultural therapist who'll be working with them in the garden, and then they can use that as a way of supporting them to talk through and tackle some of the challenges that they're facing in their lives. Now, with this particular intervention, I've structured it here around a kind of very standard logic model, which is like stripped back theory of change, just so you can sort of think about how would this work for your organization, because most organizations you can cut up into roughly these kinds of boxes. And it also picks up on some of the terminology that people often find tricky around evaluations and quantitative evaluations. But in terms of inputs, right, for this kind of intervention, you're going to need some gardens to work with. So you need some space, you need some gardens that are brought into doing it. You need project leads and mentors who are going to be there to provide the sort of therapeutic environment and also help structuring the gardening activities. Those people are going to need training, particularly if they're there to provide some kind of therapeutic support, and you need a bunch of referrals coming in. And there's probably a bunch of other stuff as well that you could talk about in terms of inputs. But for this particular program, actually it's quite an expensive one on a per person basis. So coming in at just over £3,000. That's kind of all told, all of the stuff that you need in order to get that program up and running. The activities, I could go into it in a lot more detail, but 10 weeks of horticultural therapy sessions, that's basically what they offer. It's a fixed length program, around 10 weeks long. Now, outputs and outcomes, that's often a tricky issue to discuss for lots of interventions, and something that people find confusing. I like to break it down into outputs are like the bits of the process you can count. So in this instance, they supported 111 individuals. You could talk about how many gardens are involved, or how many courses of 10 weeks have been run, or how many individual sessions have been run or attended. But it's those bits of the process you can count. Those are the outputs, whereas the outcomes are the change you want to see in the world. So in this instance, we're kind of focused in on that life satisfaction question. We're going to use that. They've asked it at the start of the program and at the end of the 10-week program. And on average, across that group of people that have been supported, we see an increase of just over 1 point on that life satisfaction scale. And actually, we can tell a bit more from that from the life satisfaction data. So they're disproportionately helping people at the lower end of that scale as well. I can't remember the exact numbers, but the proportion of people scoring 4 or below is well above the average that we have for the population. So we know that they're doing a pretty good job of targeting people at the low end, and we're seeing on average quite significant changes in life satisfaction whilst they're working with them. Right, the next tricky concept that we have here is that jump from outcomes to impact. And impact is probably one of the most used and abused words in the social sector, but we have a very distinct definition of it, which is that is the change in outcomes that can be attributed specifically to your intervention. So for all those people on these courses, there'll be a whole bunch of things going on in their life. And probably the horticultural therapy session are really important and really contributing to that improvement in life satisfaction that we've seen. But maybe actually they've got a new job, or they have received support for other mental health issues, or they are feeling physically more healthy because they've started going to the gym. There's lots of other reasons that might have contributed to that change in life satisfaction that people have experienced whilst being on the program. So how can we say how much could be down to this particular intervention? Now, basically, in practical terms, for most interventions, that's coming up with some sort of comparison or control group. And we could, have a whole session on evaluation methodologies and what's the right way of doing this. But one of the reasons we like using well-being as an outcome, as I said earlier on, is there's lots of data already out there that allows us to go and see, well, what happened to similar people over time? What sort of change in well-being did they tend to see over the same sort of time period? So for this particular program, we were able to match on a similar group of people from the Understanding Society dataset and look at, well, what sort of life satisfaction change did they see? And on average, for a similar group of people, we saw around 0.2 points change in life satisfaction, which means that the sort of net additional impact of this particular program is still pretty big. So it's still coming in at close to a life satisfaction point. And just to give you a sense of scale, one of the most researched changes that we tend to see is the impact on well-being, on the impact on life satisfaction of somebody getting into work who was previously unemployed, or vice versa, somebody losing a job. And that's around half a life satisfaction point. And that's considered a pretty big impact. So this is looking like quite a sizable change in life satisfaction we're seeing, even when we take into account the change in well-being of similar people in a similar situation who didn't receive the support. Right, then we get to putting a value on this. And this is where we can use that Treasury guidance that Chris was talking around earlier, the £13,000. What happens if we apply that valuation to this? Well, this is where that issue around how the follow-ups and how long after the initial baseline they are starts to become very important. Because actually, these measures of life satisfaction were done at the start of a 10-week program and the end of a 10-week program. That is very different to looking at it at the start of the program and 12 months later. And that adds uncertainty as to, well, how long do we expect this increase in life satisfaction lasted for? Did it drop away as soon as people stopped attending the gardening program? Was it all of that fresh air and chance to be in the open air and meet people that were created by that horticultural therapy? Does that just get lost as soon as they stop attending? And do we see that life satisfaction drift away? Now, we don't have data on that as yet for this particular program that I'm talking about. So that means that we have to start thinking about assumptions about, well, how long do we expect that impact to have lasted? And we can look at that in a couple of different ways. So the first one is, well, look, if that effect, that improvement in life satisfaction lasts just 12 weeks, then applying that Treasury valuation, we know that the benefits would be around £3,250 per person. So the benefits of the program would outweigh the costs. So all we need to believe for this intervention to look like value for money is that those benefits lasted for just 12 weeks. That doesn't sound completely inconceivable. But if over time we're able to build up evidence, actually those 12-month follow-ups, and this is why that becomes such an important thing, that you can start to say, okay, we're seeing that improvement in life satisfaction last for a much longer period of time. Okay, if those improvements did last for a 12-month period, so if we're able to build up that evidence, then actually the benefits would look far more substantial. So we could apply that treasury valuation, and actually rather than it just breaking even, we'd be looking at more than £4 of benefit for every pound spent. And that starts to become really quite a powerful story. And this kind of goes back to that data collection we were talking about earlier on. If you are able to get that sort of 12-month follow-up, then the quality of evidence, the strength of conclusions you're able to draw is even stronger. But even if you can't do that, even if you can just do it at the start and end of a program, we can still draw some conclusions from that. And these can be useful in terms of talking about the benefits. And we could put this into a pounds and pence terms, and we could use other assumptions for, well, what about if it was 3 months or 6 months? How long would you have to believe this effect lasts for? And we could draw on other evidence for how long these effects have been seen to last in other sorts of programs, similar programs. But hopefully that helps you see how you can build up that picture on quite a practical basis of the well-being impacts of particular interventions. And just very quickly before I wrap up, if that sounds of interest to you, if that sounds like something you would be keen to do more of, then we actually have a dedicated program support that we're putting in place for loneliness organizations, because loneliness has such a big drive, is such a big driver of well-being, or particularly low well-being. We're keen to do far more work with loneliness organizations than we have been doing. So we would be keen to work with more of you. We're running a dedicated training workshop towards the end of March. If you're interested, then please get in touch and sign up. We've got the QR code, so you can get that. Otherwise, you can email the address that we've got there. Get in touch with us. We'd be keen to work with you. Starts off with a training program, which is split across 2 half days, delivered online, and that sort of gives you a far more expanded version of what I've covered, a lot more structure for thinking about your intervention and what matters for economic evaluation more generally. And there is also potential to get follow-up one-to-one support for thinking about what that means for you guys. And if you've already got the data, if you're in a great position, we can also start to think about whether we'll be able to support you by delivering an economic evaluation, so you get a report that talks about the impact that you guys are having. So please do follow up with us if that sounds of interest for you. If you're not in that position of thinking about economic evaluation right now, but you have other data issues and needs that you want to worry about, we have a database of more than 1,000 economists from across the social sector, the public sector and private sector, who are all interested in supporting you. So if you've got some data that you want some support with, both in terms of getting insights, visualizing it, helping to automate reports, that's the kind of thing we can support through a slightly different routes, which is the Data First Aid program. So there's a link to that as well. And I'll stop what is it, a sales pitch if I'm selling free stuff?
No,
but
it's not. Yeah.
I'll stop the pitch now and stop sharing.
It's brilliant, John. Thank you, John. And I just want to say, just on those last 2 slides, I'm just to emphasize, well, first of all, thank you so much for that offer to everybody on the hub, to this group, and we'll if it's okay, we'll put that that offer onto the hub as well, which, as you know, has 1,000 members or plus. I just wanted to say we Navy Lab are working with you, John, on in fact on that horticultural program that you described, and I can't recommend PB highly enough. It's just a brilliant people to work with, and also just to remind everyone, PB is a charity, it's a non-profit, so it's not really, as you say, you joke that it's a sales pitch, but it's an extraordinary organization offering that service, so make use of it. But I know there was lots of questions. There isn't much time, but I was actually going to ask Chris, because you've been fielding some of the questions in the last 10 minutes or so. Do you just want to say a couple of minutes and pick up on some of the themes that you think are most kind of generally useful for people to highlight from a Q&A? Would you just say a little bit about that?
Yeah, so I think I try my best to answer most of the questions. I'm not sure I was that successful.
Yeah, no, you were great. Yeah.
There was a common theme was sort of like where to get data on Wellbees, and sort of like how to sort of like estimate, how to like get confounding factors out that might also influence an intervention. I think John actually explained it very well, that you need to have some sort of like comparator group. So either you run your own randomized control trial where you collect sort of life satisfaction data before your intervention and after your intervention to see the impact, and then also in a sort of control group before the intervention and after, and you can see sort of like what would have happened if the intervention wouldn't have been taken place. And in many cases, you can't run this logistically. And then, as John has said in his example, you can sort of like use a matched comparator group from available secondary data, right, which can be accessed via the UK data service, for example. And I think one of the other points was sort of like an understanding question in terms of how life satisfaction relates to well-being. So life satisfaction is the underlying question, right? Sort of like the measure. And the well-being is simply how to, and a tool on how to like, you know, take changes in life satisfaction and monetize them. So because one well-being is simply, 1 point of life satisfaction on a 0 to 10 scale for one individual for 1 year, and that's valued at £13,000. So if you have like any sort of like change in your intervention that is say for 0.1 points on a life satisfaction scale, you simply multiply this with 13,000 and then you get 1,300. So that's sort of like, I think, in terms of the understanding. And we're particularly interested in life satisfaction because that we want to see the full picture on how people's life is changed by an intervention, not only sort of like their family satisfaction or job satisfaction.
Yeah.
Yeah.
And I think the point, thank you, Chris. And I think, John, the point you made about why you consider well-being to be very useful for loneliness interventions is a point well made, which is, as you point out, almost all interventions are tackling something. I mean, either are designed to be oblique, as we all know, for loneliness interventions, to do with come for a chat or mend shed or things, but also, as you say, have much more wider impact on other good outcomes as well as just loneliness. So that feels like that makes good sense.
Yep. Just to add to Chris' point around why life satisfaction, I think it's a more stable measure of well-being than some of the other domains of well-being as well. So something that people often worry about as well, is my well-being just affected by whether I've just had a really good lunch or I've just had a really bad conversation with someone? And some domains of well-being can be influenced by that. They are deliberately short-term and focused on your affect, as Christian said earlier. So your mood, whether you're happy or anxious. Overall life satisfaction tends to be a lot more stable to that, which is a good thing in that it's not therefore buffeted by those kind of short-term things that impact everybody's lives. It's also a good thing, I would say, in that it's quite challenging to move. So it's not necessarily something that changes dramatically easily. You have to be doing something that's really quite meaningful for someone's life to see those changes. That said, for most of the interventions we've looked at using well-being, we have seen some pretty big shifts because generally social sector organizations, charities are tackling people at that lowest end where they are really struggling in terms of the quality of life. They might be faced with a number of different challenges, and these interventions are making a real difference. So I think when you see a change in it, you should be very satisfied that you've improved people's life satisfaction, because that's not necessarily an easy thing to do.
Yeah, and thank you. And last question, which came from David in the chat, but so is the government paying attention? If to the end of your theory of change model, if you get to that figure of £4.20 benefit for each pound spent, does that carry weight now in Whitehall or amongst funders? Is it where you would hope it would be in terms of having a kind of impact in terms of unlocking funding, for example, or and so on?
Chris, do you want to go first, or do you want me to? I suspect we both have got our views on this.
Yeah, I think so. I think it's sort of like it's new, right? So it's sort of since 2021, so it's 4 years old, and sort of like we are working hard on sort of like educating people in the use of it, including civil servants. But there is, I think, also since the change of the government, I think there is increasing interest in that, and also people are listening to it more. So in the Treasury, for example, we are organizing a workshop on it with the LSE to simply teach that to civil servants in the Treasury. And there's the Wellbeing Analysis Board, which is consistent of different government department representatives, and there's increasing interest and it's being used. I mean, depending a little bit on who you're talking to. I mean, there are some departments which are like charities more into sort of like showing their intangible benefits, right? Which is naturally culture, sport, DCMS, history, historic England, natural England, DEFRA. They kind of like need to show stuff that are generally difficult to monetize, and hence the wellbeing data are more standard there than in Department for Work and Pensions, for example.
Yeah, that makes good sense. Yeah. Okay, amazing. A massive thank you from us all, Chris and John. It's been brilliant, and people, and you can see that from the chat and from the thanks in the chat as well. So a huge thank you from the Tackling Loneliness Hub and all of us involved in it. it would be wonderful if you'd keep an eye, join the hub and keep an eye on it, because I know there's going to be more conversation about this going on inside the hub kind of in the coming weeks. So please keep on that. There's a survey. If everybody just would take 20 seconds as you leave the webinar, it'd be amazing if you just do a quick survey. And just a huge thank you for everyone, for the speakers, for John and Chris, and for everyone who's come to this. So thank you so much. And see you.
Very much.
Yeah, brilliant.
Thanks,
Thank
bye.
you. That was wonderful. Thanks a lot.
Thank you.